It is easy to assume that some medical conditions are hopeless with no chance of recovery. So when the hand of factory worker Victor Atipo was completely chopped off by a sawmill he was working on, it could not have been far-fetched to conclude that such a hopeless situation had arisen. Victor was, however, rushed to the hospital, where after an 8-hour surgery, his hand has been reattached. Well, doctors are calling this a rare occurrence, at least in Ghana's medical history. Daniel Datse visited the Korle-Bu Teaching Hospital where the surgery took place and gives us the update.
I'm sure you are familiar with the ladies' accessory called the handbag. A handbag was used in this very premises a few weeks ago, but I'm not speaking about something to keep your lipstick or your accessories in. I'm speaking of a plastic bag which carried a human hand, literally. A factory worker here in Accra had his hand severed off by a sawmill, and he came to the hospital, to the Korle-Bu Teaching Hospital, where we are now, after he had visited the Lekma Hospital and the 37 Military Hospital, carrying his hand wrapped in a plastic bag, and the hand, of course, lying in ice. Thankfully, he left the hospital a few weeks later after a successful surgery with his hand fully attached. Of course, this is not a miraculous story that you hear from a pulpit, but this is something that happened right here in the Korle-Bu Teaching Hospital. And today we've visited Dr. Kwame Dako, who is a member of the medical team that carried out this surgery. Dr. Dako, I believe congratulations are in order.
Thank you very much, but it's all in a day's work.
Great. Now, first of all, tell us a bit about yourself and the work that you do.
Okay, so as you said, my name is Dr. Kwame Dako. I'm a senior specialist plastic surgeon here at the National Reconstructive Plastic Surgery and Burn Center in the Korle-Bu Teaching Hospital. I've been working here as a plastic surgeon for a number of years after my residency, and on a daily basis, what we do here is we attend to burns, as everybody knows we do, along with all forms of reconstructive surgery that may be from a birth defect, what we call congenital, or it may be from trauma, as the story you're depicting. And we also do different forms of cosmetic surgery as well as cancer surgery. So that's just to the tip of the iceberg of what we do. But virtually we operate from head to toe.
So when it comes to the human body and something that you feel should be reconstructed or should be corrected, this is the place to be.
That's right. This is where you should come.
You had quite an interesting case a few weeks ago. Tell us about it.
Okay, so this was a young gentleman in his 20s, a factory hand at a sawmill. Somehow he got his hand put in the wrong place while the sawmill was running, and the saw literally chopped his hand off, completely off. The difficult part was this is a young man who is right-handed, who has his right hand chopped off. It happened in the Teshi area, and I think they managed to get him to the Lekma Hospital. Kudos to the medical staff there who immediately assessed the hand, packaged it the way we needed it to be packaged, and then moved him on to 37 Military Hospital, where there's also a plastic surgeon at post. He, also making an assessment, realized he didn't have the full team at that point in time to undertake the surgery for the gentleman. Also reassessed, repackaged the hand again, and then pushed him on to us here in Korle-Bu at the accident center, where the emergency processes went into place, and we were called to literally put this man's hand back on his body. Okay, so that's basically what happened.
Take us back to that day when you were called that this has to happen. How was it going for you?
Okay, so basically we were on our regular cover for duties, and we had a call from our colleague who was at 37 Military Hospital, who recognized the injury, assessed it, and called us that this is what is happening and he needs to send it to us. So we should also get ready to receive the patient and put things in place to take care of him. What I must commend is that from the point at which the injury occurred, the gentleman was sent to LECMA within 30 minutes, and within 2 hours of the incident, the gentleman was here in Korle-Bu through 37. And within 4 hours, we were able to get him into theater and begin the surgery, which eventually ended about 8 hours after we started, to put his hand back on his arm.
This transit that took 4 hours, we often hear of cases that do not take that shorter time at all. What do you think accounted for that at LECMA and at 37?
I think it's basically the medical staff, medical personnel who he met there on that day. They were alert enough to assess the situation, realize that it is something that can be done. Fortunately, some of the doctors during their training had passed through this place and knew the kind of things we can do. And so they immediately pushed him on to the next level of care, and they subsequently assessed their situation and the chances of being able to do it there, and seeing that they couldn't do it in time, pushed it on to where it could have been done in time, and which was at this facility. That's basically what saved the man's hand, getting here in time and preserving the hand appropriately by the medical staff.
From what you're telling me, it's the work of the staff on the ground at that point which was able to expedite the transit of the man from LECMA through 37 to this point.
Yes, I believe so, because without them, they probably may have gone to the wrong facility, and he wouldn't have gotten here in time for us to save the hand, because there is a time limit as to which, for how long, once an extremity, be it the finger, the hand, or anything else, is off the body, to which we can reattach.
What's this time limit?
It's a bit complex, but it all depends on the level of the injury. So the closer towards the fingers, the longer amount of time you have to get to hospital. But then as it comes towards the body, towards the wrist, towards the elbow, and then towards the shoulder, then the time period is shorter. So basically, if you're getting to the hospital within 2 hours, definitely at any level, if it's salvageable, we will be able to salvage it. So we don't see a lot of these cases to this extremity. When I say this extremity, I mean the hand completely off. We have had a couple over the past years, some where the hand has been completely off. I think the last one was about 2 years ago, in which basically there was just a piece of skin with a single blood vessel holding the hand in place. There are some in which we have a deep cut across the wrist, which has taken out both blood vessels and a number of tendons and nerves. So in that case, the blood supply to the hand is the same as if it was completely off, because all the blood vessels are cut off. And we do those on a regular basis. Some go through accidents and have this injury. Some even have a cut across their elbow, in which the main blood vessel to the hand is cut. So more or less, there's no blood supply. If we don't rush in and repair this blood vessel, the person will lose the hand. So even though we don't get a case of this extremity on a regular basis, we do get so many cases where there's a wrist laceration and blood vessels, nerves and tendons, and sometimes even bones are cut, in which we have to go through a similar procedure, but not as tedious as this one.
So take us through this tedious process. I know it's a lot of medical jargon and technicality, but as much as possible, help us understand how you went about it.
Okay, so basically for these cases, what we are looking at is repairing the bone. The bone must be fixed, and we need the help of the orthopedic surgeons to do that in some cases. Once that is done, we need to repair the tendons. The tendons are what are going to allow the dexterity of the fingers, the movements back and forth. We also need to repair the nerves for sensation, and we also need to repair the blood vessels for blood supply before we come to stitching muscles and skin. So each of these must be done in a particular way. Each of these must be prepared in a particular way, because once they are injured and damaged, we don't just start stitching them back together. We need to prepare the ends, particularly with the blood vessels, because if the blood vessels are not prepared properly and stitched properly, they will form a clot and you get no blood flow. So I think in a nutshell, that's basically how we do it and what we do.
you made it sound very simple. Just put the bones together, put the tendons together, and then the muscles follow. But this is a process that took 8 hours. The concentration, the teamwork, how was that like?
I think over the years we've been doing similar cases, but like I said, not of this extent. And so when it comes, we know what to do and we're ready for it. Many of us, in fact all of us, have had some form of extra training in different facilities all over the world, where some people do this more often than many other places. So with that extra training that we've all had, it makes us understand and know that even in the most specialized of centers in the world, this is exactly how it's done. And then we follow that to the book right here in Ghana, and we did it exactly as it would have been done anywhere in the world, because we've done it before, and we continue to do it in that way.
If we want to see cases like this being dealt with expeditiously, with this kind of success rate on a regular basis, what would we require, in your perspective?
In my perspective, it boils down to the ambulance system, because irrespective of the number of health personnel at any particular facility, be how remote, once they make the assessment and diagnosis and recommendation that this must go here for this kind of treatment, transport, some form of transport mechanism must kick in to send the person to the right place. It's all nice to be in Accra, where you can sit in the back of a taxi and blow your horn and move through, and people actually move out of the way. But then when you're slightly out of Accra, out in the hinterlands, then the transport system becomes extremely problematic. So that is a transport system that's key. And then communication between the facilities. If this does happen anywhere, be it in your house, in a factory, by the roadside, you may not know what is salvage, what we can salvage and what we cannot salvage, but you must transport it to us in the appropriate way, which is basically picking up the extremity, the digit or the hand or whatever it may be, wrap it in a bag or handbag as you were putting earlier, and place this bag on ice or in ice. You do not put the ice or water directly on the severed extremity. You destroy some cells and they will not be able to repair it. So once you do that, all would be well.
Tell us about this patient. When you got to meet him after the surgery, how was that relation like?
So basically, this is a young man who's starting out life, an apprentice or a hand at the sawmill, and he's trying to make some money, not to stay there for the rest of his life, but to move on and start his own little business. So for him to have his hand back, now he's going through the physiotherapy protocols, having regular exercise to relearn how to move those hands, make sure they don't get stiff, so that one day he may be back to doing whatever he may want to do. I mean, in many cases where you have good physiotherapy and regular physiotherapy, he may get up to 80-90% of his function back. People come to us with different requests. We tend to remind them that we are not magicians. We are not God. We can't recreate what is there. So it's not possible for us for him to get 100% of his function, of his strength and function back. But he will get a good amount of workable function, which he can carry about his daily chores and even do some tedious work with it once his physiotherapy regime is over.
Would you advise he goes back to working in a factory?
If he follows the appropriate factory safety precautions and guidelines, he could go back.
So for the hand would be able to work well in any setting at all?
Yes, once he goes through once we've done the surgery and he goes through the physiotherapy, there is no reason why he can't go back. But I just advise that he follows the appropriate precautions and factory guidelines to prevent accidents.
And how long do you think it will take before he can get back to normal?
Normal for me would mean that he would be able to carry out his regular daily functions, eat with his hand, take care of himself, wear his own clothes, ironing. So within 3 to 4 months, if he follows a physiotherapy protocol, he should be. If he continues with doing his physiotherapy beyond that, then maybe after about 6 to 9 months, he'll be back at work.
Thank you very much, Dr. Kwame Dakum.
Thank you for your time here.
So you may think of him as a miracle worker, but he really is the acting medical director here at the National Reconstructive Plastic Surgery and Burn Center at the Korle-Bu Teaching Hospital.
Well, we hope that also you've been inspired by that report put together by Daniel Datsey. But it also means that, well, we have some of the best medical personnel or experts in our country. We have to make good use of them, but also we have to praise them consistently for the good work that they do, despite the challenges or the difficulties that they encounter. But let's move on. We'll be talking about the second focus fundraising event to support surgeries of some 100 underprivileged children. Well, we'll be talking about that all in a bit. Do stay on. We'll be right back.